Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. Today I'm going to tell you a little bit about measles, scarlet fever and slapped cheek. Measles is back. It's really sad that I'm saying that, because I honestly hope that we had eradicated measles with a really good vaccination programme. There are now more cases of measles than there were in the 1960s, and it can be a very serious illness. So it's very sad, and please, if you're watching this and you've got children that haven't been vaccinated, please get them vaccinated, because that is the best way to eradicate this horrible disease. It's highly infectious, it's viral, and it can often lead to complications. It can affect any age group, but it's most common in young children. The infection usually lasts from 7 to 10 days. However, it can cause life-threatening and life-changing complications. It can affect people's lungs, and it can affect their brains and causes brain damage. And it's particularly serious if somebody gets measles and they are pregnant. So the initial symptoms of measles develop at around 10 days after the infection. So you are infectious before that point. Cold-like symptoms such as a runny nose, sneezing and a cough. And then you develop sort of sore eyes, red eyes that may be sensitive to light. You get a raised temperature, which can be extremely high. And then you get these small greyish white spots, particularly on the inside of the cheeks, that are a classic symptom of measles. And then a few days after that, you get the reddish brown blotchy rash, which starts coming up. It usually starts on the head or the upper part of the neck and spreads to the rest of the body. So phone your GP as soon as possible if you think that you've got measles. They will probably not want you to go to the surgery. So they will make special arrangements to advise you without you going in and risking infecting people, particularly other pregnant people that might be in the surgery. Measles is highly contagious. It's a droplet virus, which means it's spread through coughs and sneezes. It can survive on hard surfaces for quite a few hours. And so it's really important that you are recognising that and doing really good hand hygiene, disposing of tissues and things carefully, and making sure that you're wiping down surfaces. So people with measles are infectious from when the symptoms develop until about 4 days after the rash first appears. So once the symptoms start developing, until about 4 days after that rash, they need to make sure that they are not in contact with other people. So measles is best prevented by having the MMR vaccination. And the more people that are vaccinated, the less chance and the greater that people will get it, and the greater chance that we will eradicate this. So adults and older children can be vaccinated at any age if they haven't been vaccinated before, and the GPs will gladly do that for you. And if the MMR vaccine isn't suitable, there is a human normal immunoglobulin that can be given that can reduce your risk of getting measles. So the key thing is hand hygiene in treating. So in order to relieve symptoms when someone's got measles, you want to make sure that, taking paracetamol or ibuprofen will be very helpful to reduce the fever and the aching. Drinking plenty of water and remaining hydrated. Closing the curtains can help reduce the light sensitivity and make it easier for the eyes. And cleaning the eyes with a bit of damp cotton wool and disposed of hygienically can be helpful as well. They must stay away from nursery, school or work, and everybody needs to be really careful with that hygiene factor. Make sure that they're not passing it on. Right, so that was measles. Scarlet fever, it's again back. There are more and more cases being reported. It's highly contagious. It affects young children, it affects adults as well, and it lasts about a week. It can start with flu-like symptoms, including a high temperature and swollen glands. A rash will appear a few days later. The rash usually starts on the chest and tummy, and it's rough to touch and red in colour and looks a bit like sunburn. And the tongue can develop a white coating. So if your child or you have someone who is developing those signs, contact your GP. Again, they may not want you in the surgery, so phone first and explain that you think you might have scarlet fever. If a week after the initial symptoms you're still unwell, you should definitely contact your GP again, and it's especially important to do this if you've had chicken pox. Because it can be a sign of complication, and you can develop pneumonia from scarlet fever. Treatment, the GP is likely to prescribe antibiotics. Although they won't actually cure the scarlet fever, they may well prevent complications occurring. People who suffer from impetigo, skin disorder, are more likely to develop complications, and they need to be extra careful. You need to give the person lots of cooling fluids to drink and soft foods because their throat will be very sore. Paracetamol can be helpful to lower the temperature and just relieve the symptoms a bit. And antihistamine and calamine lotion can help the itching from the rash. In terms of avoiding it spreading, it's exactly the same in terms of hand hygiene and just really sensible disposal of tissues and things. Right, the last one I'm going to talk about is slap cheek. Slap cheek can often be mistaken for scarlet fever. It starts with a rash on the cheek, and it looks like the child has been slapped. And then it sometimes spreads to the body a few days after that. The rash usually lasts for around 2 weeks, but can continue a bit longer. They may have a headache, a sore throat, and a high temperature. You don't normally need to see your GP for slap cheek. A pharmacist can often give you some sort of antihistamine or some calamine lotion if the rash is very itchy. For itchy rashes as well, certainly for chicken pox, sometimes putting some porridge oats into a sock and running a bath through that can be quite soothing for them as well. Paracetamol will help reduce symptoms and reduce their temperature as well, and they should drink plenty of fluids. But slap cheek is generally not as serious as measles or scarlet fever. I hope that's been a helpful overview. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.